Welcome, everyone, and thank you for joining us today. We'll wait a minute to allow others to log on. Welcome, everyone. We are excited to have you today for Data Dialogues, our May Advancing Throughout the Year webinar. Today, our guest speakers will focus on how data informs collaboration, continuation, learning, and collective action across the region. Now, just a little bit about Advancing Throughout the Year. LiveWell San Diego works with recognized partners to host a series of webinars and networking events to build on topics and connections made at the LiveWell Advanced Conference and School Summit. We are here to stay connected, share new insights, learn from our community partners, and continue the important work we started together. Don't forget to check out our LiveWell San Diego Top 10 and Expanded Indicators. These indicators show how we measure living well across our region. We'll put the link in the chat. They help us understand and guide us in building a region that's living healthy, safe, and thriving. By grounding our work in shared data, we can make stronger data-informed decisions and continue making advancements through collective impact. And finally, a big thank you to everyone who shared dashboard suggestions in the registration form. Our team will be reviewing your input and updating the regional data website. Again, we'll put that in the chat as well, but keep an eye out for these updates in our post-event recap email. My name is Jeff Jimenez, and I'm with the County of San Diego's Health and Human Services Agency, and I'm honored to be your moderator today. Here's a look at this morning's agenda. We'll begin with our first presentation from the University of San Diego, followed by a Q&A session. Then next, we'll move into our second presentation from the county's Community Health Statistics Unit. And again, we'll close that segment with a Q&A session. At the end, we'll wrap up with a few feedback questions and closing remarks. So let's get started. A few reminders before we begin. The webinar is being recorded and your lines are muted. Please remember to submit your questions in the Q&A box, which is a button at the bottom center of your screen. If you have comments to share during the presentations, you can input them in the chat box. Due to time constraints, if we do not get to your question today or want to reach out to our team, you can follow up with us via email at the address listed on the screen and shared in the chat. We'll also be sending out answers to any questions in the PowerPoints in our follow-up recap email. If you would like to receive a recording of today's webinar, please sign up for our email updates by scanning the QR code or clicking on the link again shared in our chat. We will also be uploading the recording of this to our virtual connection hub page. So check it out there as well. Our first presentation is titled Tracking Quality of Life in the San Diego Region. To kick off our first presentation, I'm honored to introduce our colleagues from the Nonprofit Institute at the University of San Diego. We'll hear from Dr. Tesla Tinkler, Senior Director and Research and Evaluation at the Nonprofit Institute. Dr. Tinkler has over 20 years of experience conducting research and evaluation in nonprofit and educational settings. She leads the Institute's contracted evaluation projects and ongoing studies on San Diego's nonprofit center. She earned her PhD in education from UC Santa Barbara, and her recent work spans community-wide needs assessments, nonprofit foundation partnerships, early childhood STEM research, and economic impact studies. Joining Dr. Kempler is Io Hanabusa, Research and Communications Coordinator at the Nonprofit Institute. Io is a key researcher and the driving force behind the Equinox Project's Quality of Life dashboard. Her work bridges research, evaluation, and communications, helping ensure that data and insights are accessible and actionable. With a background in conservation and environmental education, EO brings a unique ability to translate complex, big picture challenges into clear, meaningful information for a variety of audiences. Again, if you have any questions for our presenters during the presentation, please put them in the Q&A box to be addressed after the presentation. With that, I'll pass it over to you, Dr. Tinkler. Please take it away.
Thank you, and good morning. It is wonderful to have you all here today, and we're so grateful to be able to share the Equinox Quality of Life Dashboard with you all. And in just a moment, I'm going to pass this on to EO Hanabusa, who will walk us through the dashboard and how it can be used as a resource for our community. But before that, I just want to tell you a little bit about the Nonprofit Institute, for those of you who may not know us. So we are located in the School of Leadership and Education Sciences at the University of San Diego. And our work is grounded in three pathways that shape how we create impact, which you can see on the screen: transform, know, and advocate. The transform piece refers to our leadership development and capacity building programs that we offer, where we collaborate with leaders as they adapt and evolve their work to better meet community needs. So definitely keep an eye out for our leadership programs and capacity building programs. Know refers to our research, and this is where EO and I spend a lot of our time. For over 20 years, the Nonprofit Institute has conducted research that informs the work of nonprofit professionals and other stakeholders such as yourself. And this research includes our annual State of Nonprofits and Philanthropy report and the Equinox Quality of Life Dashboard, which we're going to talk about today. Then we take that knowledge and we use it to advocate for nonprofits in San Diego and the communities they serve. And so now I would like to invite EO Hanabusa to share the dashboard with you all.
Thank you, Tessa. So before I dive into the dashboard itself, I would like to share the learning objectives that we have for our section of the presentation. So by the time we are done speaking with all of you, you will have learned about the dashboard, the different indicators that they have, and the data they contain. We will also go through the outdoor access indicator to show you the basic construction of a page, and we will go through some charts to interpret them, and you will be able to see how that could help with things like reporting or planning or any sort of decision making that you may do in your work or even in your personal life. And then finally, we will go over an example of how we have used the dashboard to inform some real world tasks. For us, it was a presentation with some public officials, but for you, it might be something like grant writing or program planning or anything else that you can envision yourself using the dashboard for. So without further ado, we will go through the dashboard page. The URL for the dashboard is www.sandiego.edu/dashboard. You're welcome to follow along, and we will also put this link in the chat, but I will walk us through virtually so you can just watch on your screen as well. When you follow the URL, it'll take you to the homepage of the dashboard, which looks like this. Equinox Project's Quality of Life Dashboard. Is San Diego's quality of life improving? That is the question that the dashboard seeks to answer. When you scroll down, you will see 14 different indicators spanning a variety of topics across environmental, economic, and social topics. So those include air quality, civic engagement, residential energy use, housing, and so on and so forth. This is by no means a complete set of indicators, but they each tell a facet of quality of life here in San Diego. Today, I'll be going over the outdoor access indicator. When you hover over a tile, it will flip over, showing the rating. So in the case of outdoor access, it is given a mixed results rating, and a quick blurb is available to explain why it has that rating. So for outdoor access, the region enjoys a lot of park space, but low-income neighborhoods have less access. So we will go through this indicator to see how a typical page on the dashboard may look like. At the very top of the page, you'll see the title of the indicator, and then right underneath there is a section called how are we doing, which is an area where we explain what the indicator is, as well as some high-level trends that we're seeing. Are things improving? Are things not really changing? Or are things worsening? But that is all summarized with this rating that you see on the right-hand side. So again, with outdoor access, it is mixed results, which is represented with this gray circle with a dash in it. If things were improving overall, it would have a green thumbs up, or if things were worsening overall, we would be giving it a red thumbs down. So again, the reason behind the rating is explained right underneath here, and we will go into the data to explain why we have this explanation here. But before we go into those charts, since outdoor access may be somewhat unfamiliar to some people, I would like to demonstrate what it means. So outdoor access measures the availability of park space in a given area, as well as the ease of being able to visit such outdoor areas. So at this time, if you have a device available for you, I'd like to invite you to join a poll to demonstrate what outdoor access means, at least with how it's defined on this dashboard. So if you're tuning in on your desktop, I invite you to open a new browser tab to www.menti.com, and please enter this code 73288461. If you have a mobile device available with you, you can open your camera to follow this QR code to the poll as well. I will give this a few moments to populate. And I will move on to the next slide, but the QR code will still be available for anyone who still would like to join the poll. So my first question to everyone here is, have you visited a park or beach in San Diego? This includes places like trails or any open spaces, a park with some basketball courts, the beach. Um, I will let this populate a little bit more, but anywhere in San Diego. Okay, seems just about almost everybody has responded. I'm going to move forward to show the results. 100%. Fantastic. So we are on track today. At least for those of you who are able to sneak in your answer, everyone has visited a park or beach in San Diego, which is wonderful. I have another question for you. The wording is slightly different, so please pay attention to that. Do you live within a 10-minute walk or a half mile of a park or beach? Yes or no? Please let me know. We are almost there. Thank you so much for your participation in this poll. I'm looking forward to what the results may be. Okay, it looks like things are starting to slow down a little bit, so I will go ahead and move forward. Oh, interesting. Okay, so it looks like oh, it's moving a little bit, but let's say for the ease of numbers, 60%. So of the people who answered this poll, 60% live within a 10-minute walk or a half mile of a park or beach, which is great. Not too bad, I would say. Living within a 10-minute walk of a park is considered having good access to a park or good outdoor access. So let's compare this to the city of San Diego. So back onto the outdoor access page, the first chart that you will see looks like this. Here, we are comparing the city of San Diego to other cities in California. And there are two items going on here. One is looking at the population that have that walkable park access. The great things about the charts that you see on the dashboard is that you can click on items in the legend to hide things for ease of viewing. So we'll keep that 60% that we just saw for this virtual Zoom room here and look at the city of San Diego. For the city of San Diego, 81% of residents live within a 10-minute walk of a park or beach, which is really great. And we see compared to other cities in California that are also fairly large, we are in a fairly good place. On one end, we see San Francisco, where 100%, so wherever you live in the city of San Francisco, you're within a 10-minute walk of a park or beach. But that is not the case for residents of Los Angeles, where 62% of residents live within a 10-minute walk of a park or beach. So this virtual Zoom room is sort of at the level of the city of Los Angeles here compared to the city of San Diego. So another way of measuring park access is also the availability of park space, which is this other trend line here, shown in green. So for the city of San Diego, for every 1,000 residents, there are 31 park acres, which is an ample amount of park space, especially if we compare it to the other cities that we have on this chart. So San Francisco, we remember, it is at 100% in terms of the residents and their living within a 10-minute walk of a park, but there is only 8 acres of park space per 1,000 residents. But we also understand that San Francisco is much more densely populated. But if we look at these two elements together, we see that the city of San Diego kind of enjoys this sweet spot where many of the residents there do live within a 10-minute walk of a park, and there's ample amount of park space for them. This is where I'd like to highlight the data source. Under each of these charts, you will see where we got the data from. In this case, it is from the Trust for Public Land, which is a nonprofit that advocates for public land conservation and also public or park access. One of the things that they do is they assess all the cities in the United States, the park space that's available, the percent of residents that live within a 10-minute walk of a park, the amenities they have, and even some demographic breakdowns of who has access to a park or who doesn't have access to a park. The next chart that we have here shows the jurisdictions that they have data for in San Diego and ordered from greatest to least. So for the county of San Diego, we see a place like Coronado, 91% of residents live within a 10-minute walk of a park or beach, which might make sense geographically speaking. On the other end, we see Vista is at 48%. So there might be challenges with outdoor access there. But overall, we see that at least across these jurisdictions, 48% of residents have or live within a 10-minute walk of a park or beach. So this is one way that we provide an overall picture of what might be going on in the county, though this is limited to what data we have available through this particular data source. Moving onwards, this is where the story changes a little bit. So we are still comparing the city of San Diego to other cities in California, but this specifically looks at low-income neighborhoods and the access that they have to the outdoors compared to high-income neighborhoods. Generally speaking, high-income neighborhoods have a greater access to park space, but the picture for San Diego looks a little more dire, where low-income neighborhoods only have 14% of the park space that high-income neighborhoods have. So there's a greater disparity there compared to, say, our neighbors in the north for San Jose, California, where low-income neighborhoods there have 87% of the park space that high-income neighborhoods have. So in this way, we are able to see that the city of San Diego, though most residents live within a 10-minute walk of a park, that story starts to change when we look at the socioeconomic status of the residents there. So for outdoor access, those are the charts that we have. On a typical page of the dashboard, you will see charts similar to these, also maybe some maps. And in addition to these charts and map, we feature other research or other reports that might be relevant to this indicator or relevant to the region to add some context or add some additional nuance to the story. In the case of outdoor access, we have the San Diego Foundation's Parks for Everyone report, which is a report that talks about barriers to the outdoors and what's being done to address such barriers. So this is where we highlight those barriers to add some additional context to the data that we have on the dashboard. So in this way, you can use the dashboard to collect some background information for your research or for whatever that you might be working on. Towards the bottom of the pages of the dashboard, we have a section called Why is Outdoor Access Important? Or Why is Insert Indicator Important? And then there are three subheadings of economy, environment, and equity. This is where we explain why the indicator is important through these different lenses. There are 14 indicators on this particular dashboard, but even though they exist on separate pages, oftentimes these indicators are interrelated, especially if we're trying to tell the story of what is quality of life. So if you need background research on understanding how you can make a case for a particular topic, but through different lenses, this is a great place to kind of gather that perspective and also understand the different relationships between indicators because they all tie back to an aspect of the economy, the environment, or the communities in San Diego. Finally, at the very bottom of the page, you will see a section called Regional Response. This is where we highlight policies, projects, and partnerships that are going on in the region or in California that are either influencing the indicator or advancing or protecting some aspect of the indicator. So this is a great place to gather background research as well. And this is also where we like to feature the work of others. So if you find that your project or a coalition that you're part of or something is relevant to the dashboard, you're welcome to contact us and we'd be happy to be in conversation with you to see how we can feature you on the dashboard. So with that is we've covered the basic construction of the dashboard and what you can expect to see on a typical page. And I would like to share an additional chart with you because I think it would be important for all of you to know. And that exists on our civic engagement page. So I will navigate through this sidebar menu here and click on civic engagement. For the Equinox Quality of Life dashboard, the data sources that we pull from can vary indicator to indicator. They might be public agencies, they might be nonprofits. In the case of civic engagement, most of this data actually comes from the Nonprofit Institute's own research, particularly our quarterly polling of San Diego residents. On the civic engagement page, you'll find data on giving and volunteering behavior, public confidence in institutions, and voting information, but one chart that I particularly like about this indicator is our issues of concern chart. How we gather this data is we poll residents on over 20 issues related to quality of life, and then we ask them to rank their level of concern for each issues. So there's a chart that summarizes all of that data, which is quite a lot. So there's going to be a lot of colors and words, and I apologize in advance. I will walk you through this so you won't be lost. But that is the first chart on our civic engagement page, which looks something like this. So on the left-hand side, we see the 20 plus different quality of life issues on the side here. And then on the bottom is the scale with which we use to poll these residents. So the highest level of concern is alarmed, followed by concerned, and then so on and so forth, all the way down to unworthy of consideration. Again, this is a great place to utilize the function where you can click on items on the legend to put things away for ease of viewing. And I'm going to do that just so we're not overwhelmed with all of the colors. For this particular chart, we ranked from highest to lowest the percent of residents that said their level of concern was alarmed, so this red color here. And perhaps unsurprisingly, we see many residents are concerned about homelessness at 52%, followed by affordable housing. And then there are many other issues that we have, like mental health, traffic, severe weather, um, outdoor access, which we just went over, is down here. So this is a chart that might be useful to you to understand need or concern that residents have if you need to build a case for a particular issue, or even compare how issues might be garnering concern compared to one another, or perhaps maybe more work needs to be done to raise awareness about a particular issue. So this is a chart that I wanted to leave with you before I move on to the next part of my presentation. Okay. So we have now finished interpreting a few dashboard charts. I would like to go over an example of how we have used the dashboard in our work. A few years ago, a group of public officials invited us to share some dashboard data to understand rent in San Diego and wages. This was a few years ago, so I updated the data with more recent data, which I will share with you now, so it feels a little more relevant to us. But on the housing indicator on the dashboard, you will see a chart that looks something like this, which tracks fair market rent, which is a benchmark that is established by the US Department of Housing and Urban Development. The key word to understand here is fair. This is like the 40th percentile gross rent of a particular unit size in a given area. In this case, we're looking at San Diego County for a two-bedroom unit apartment at fair market rent. In 2015, this number was $1,390 a month. And in 2025, it was $2,881. So it may not be any surprise to us that housing costs have gone up in the region, but what does it really mean in terms of affordability? Well, one way of looking at that is looking at rent burden. Some of you might already be familiar that households are considered rent burdened if they spend more than 30% of their income on rent and other housing costs. So if we make a very aggressive assumption that one works 40 hours a week for the 52 weeks in a year, how much would they need to earn hourly in order to afford that fair market rent apartment without spending more than 30% of their income? Well, if we do that calculation, that number is $55.40. So that is the hourly wage needed after taxes to afford that fair market rent two-bedroom unit with the 2025 number. Using data from the US Census and methods outlined by the National Low-Income Housing Coalition, we are able to calculate the average hourly wage of a San Diego County renter, which is estimated to be $29.93. And then as a way to just put things into perspective, the minimum wage in the county this year is $16.90. So there's some stark differences in these different benchmarks that we track. So we need to track what we want to change. For you, it might be a different issue. Maybe it's transportation, something related to education or health. We hope that there's something on the dashboard that could be of service to you. But with that, we reached towards the end of my presentation. In the past, people have told us that they use the dashboard for education or grant writing, even onboarding. If they have employees from outside of the county and they need to get to know San Diego, they have used the dashboard as a way to kind of give them the overview of what the region is like. So we would like to ask you how you might envision yourself using the dashboard. So we invite you back onto the poll. We would love to know how you envision yourself using the dashboard. Is it advocacy or education related? Perhaps you have some grant writing work to do or some just general research about the region, or maybe it's something else. We would love to hear from you in the chat as well. And if you're unsure, that's totally fine. We will not take any offense to that. So please let us know how you see yourself using the dashboard. and this would be valuable feedback for us in improving the dashboard as well. We are halfway there. Thank you so much for your time and consideration. I really appreciate it. This is extra data for us to take home and use. So thank you for adding data to the data. We'll take a preliminary peek here. Oh, wow. So I believe you're still able to answer the poll. Yeah, they're still coming in. But we see there are people interested in using the dashboard for advocacy, education. There's quite a number in grant writing, research, a couple people for onboarding. Some people see a different possibility, which is fantastic. I look forward to seeing your responses in the chat. And there's a few people who are unsure, which is totally fine. Please take your time to consider the dashboard. Um, I'm really grateful to see that there are many people who can envision themselves using the dashboard in some sort of way. Okay. Well, thank you very much for your attention. This was the Equinox Quality of Life dashboard by the Nonprofit Institute. If you have any questions about the dashboard or the work that we do at the Nonprofit Institute, we welcome you to contact us at this email address, which is nonprofit@sandiego.edu. So thank you very much.
Great. Thank you so much, Io and Dr. Tinkler, for the wonderful presentation. We have some time for questions, including questions submitted during registration. So please continue to put your questions in the Q&A box, and we will answer them as we have time. So we'll go to one of our pre-submitted questions first. This one is, how can organizations better align regional data insights with the on-the-ground program delivery to strengthen cross-sector collaboration between education, workforce development, and community services? How can data from tools like the Equinox dashboard be used to ensure equity-centered decision-making for populations historically underserved in education and workforce systems?
Thank you, Jeff. That's a very good question, and there's no like singular right answer to that. In terms of better aligning organization and regional data insights, I think it's about creating that space to connect over data such as this, but I know there's other forms of coming together and convening over data and information about a particular sector or even different sectors coming together. I see that a lot with our work at MPI, with our governance symposiums, or the webinar that we had with our State of Nonprofits report. But I think coming together, creating these convenings and spaces to meaningfully connect over data is how we can align organizations and data together, and also kind of unifying the people who are behind collecting the data or analyzing data and the people who actually use the data to put it into practice, so that there's that alignment there in terms of like the quote unquote workflow of how the data comes from its beginnings to the actual actions that come following. In terms of the Equinox dashboard, a lot of the data that we have provides an overview of the county, and we're also at times limited by the data that is available. Sometimes we have disaggregated data that gives community level data, whether it's more of a geographic thing, like down to the zip code or down to the census tract, or by different demographic profiles, but it really kind of depends. So I would say the dashboard gives a general direction of where to go or what things look like for the county, but there would be further data collection that would be needed to fill in those kinds of gaps to really get to the center of the question and how we can use data to make equity-centered decisions to improve the lives of others.
Thank you for that answer. We've got a number of questions from our live chat. I'll pull one from here. When putting together the information for the background research, what was your strategy? For instance, time range, geographical range, etc.
I can answer that. There's multiple sections that pull together research. There's the why is this important section, and for that area, we really try to continue to include updated research as much as possible, and we break it down into why is it important for a variety of reasons. And then in terms of the regional response, we do our own research to just be aware of what are the kind of projects, plans and that are currently going on in the region. And at the same time, we welcome input from the community. We always want to hear from you all with suggestions of what kinds of programs and plans that we could highlight. So please feel free to reach out to us if there's something that you think would be really important for the whole region to know.
Thank you. The next question that we have here, there's no category for health access yet. Is this something you are planning, you are working on or planning to expand on in the future?
I can answer that as well, and feel free to jump in. This is actually a question that we have gotten quite a bit when we've done presentations, and not just health access. We get about other indicators as well, but health access has come up. I think this is the third time now. So we don't have a specific plan at the moment, but we are always open to adding new indicators. It may be hard to tell, but it's actually a lot of work on the back end to develop a new indicator. So because there's a lot of expertise that we need to know which data sets are the best, and it needs to be data that we can actually track over time. So once again, that's another opportunity for you all to reach out to us, and we can always be in discussions about what it would mean to develop a new indicator.
Yes, thank you, Tessa. I would also like to add that I think that's where some of the efforts that Jeff and his team are doing can kind of come in. It's my understanding that we had the opportunity to submit certain dashboards, and oftentimes with there being a lot of different independent dashboards, there's potential for these dashboards to kind of do the same work that another dashboard is already doing, when really we could create greater access to data and good work that's already being done by directing them to a dashboard that's already being done well. So, adding on to Tessa's point, not only do we sort of welcome the opportunity to add that health access indicator to the dashboard, if there's a dashboard that's already doing that very well, I think we could create something where the Equinox dashboard just leads people to there. Because again, we're not the people with that expertise regarding health access and healthcare in the region, but there's a lot of great work being done. And so I really appreciate that there's that opportunity to submit those dashboards so that there can kind of be a collective place to hold all of that.
Bringing collective impact to dashboards. Our next question, this looks like it's very specific to some of the presentation. Are the fair market rent calculations you provided available on the dashboard?
The calculation method itself, I don't believe is on the dashboard, but if you contact us, I'm happy to send the PDF or the methods that I used. It comes from that National Low Income Housing Coalition, and I believe they have their methods posted that there, but I can send that to you if you contact us.
Thanks. I love this next one. I'm a researcher at heart. How should we cite data used from the dashboard in a report?
I want to type an answer just so you all have it. It's just going to take me a minute to get it. So keep looking at the Q&A and I'll put an answer in there for you all. But in reality, what matters is that you can include the Equinox Quality of Life dashboard and the Nonprofit Institute on there, but I will include that in the Q&A in just a minute.
Thanks. And we have another question here. When does the semester open for the next accelerator program?
So the next, for those of you all that don't know, this is in reference to a lot of our professional development programs that we offer. The next Nonprofit Academy is going to be in October. I actually don't think we have an exact date yet. So what I would really encourage you all to do is to make sure that you're on our email listserv and check out our social media so that you get notified as soon as our programs open. In terms of the accelerator program, that's another one where we don't have an exact date yet. So just please keep looking out for what we do.
All right. Well, thank you to our USD colleagues. That was the last question that we had in our question box. I want to now shift over to our second presentation. This presentation is titled Community Health Assessment Presentation, San Diego County and Health and Human Services Agency Regions. I'm pleased to introduce our colleague, Chris O'Malley, Chief of Agency Operations for Public Health Services at the County of San Diego. Chris leads the Community Health Statistics Unit within the county's Health and Human Services Agency. He previously served as an epidemiologist with the county and has an extensive research background through his work with the Naval Health Research Center and the Department of Defense HIV/AIDS Prevention Program. Chris is also a United States Navy veteran with more than 8 years of service and is currently pursuing his Doctor of Public Health degree at the San Diego State University. If you have any questions for Chris during his presentation, please put them in the Q&A box to be addressed after that presentation. With that, I'll pass it on to Chris. Take it away.
Hi, good afternoon, or I guess it's still morning. So good morning, everybody. Thank you so much, Jeff, for that great introduction. My name is Chris O'Malley. I am the chief of the Community Health Statistics Unit within the County of San Diego's Public Health Services Department. This is going to be a very data-heavy presentation. So if you're kind of lose your train of thought or you're too focused on the Padre-Dodger game tonight and you forget kind of like where you are and in the presentation, do not fret. The presentation is posted already to our website, and I know the folks leading this meeting are going to also share that PDF with you. So that's available to you as well. And let's just jump right into it, shall we? So first off, I'm going to go over some data measures that you'll see throughout the presentation. So numbers tell you how many. So for example, 25 children under age 15 in San Diego died of cancer in 2012. You'll also see percentages. Percentages tell you a proportion of the whole. So for example, 90% of attendees who ate potato salad at a picnic experienced symptoms of food poisoning. And I will talk about rates. Rates tell you how many per a given population and allow you to compare year to year or group to group. So an example of a rate would be the rate of children injured due to motor vehicle crashes dropped from 321.9 per 100,000 to 295.2 per 100,000 after the implementation of the booster seat program. Throughout this presentation, you're going to see data comparing the county of San Diego County to our 6 Health and Human Services Agency regions in San Diego County. San Diego County is commonly divided into these 6 regions when examining health and demographic data, and these regions can be further divided into 41 smaller sub-regional areas. And then a different way to look at the county would be divide the area by its 18 cities and the unincorporated areas of the county. Throughout this presentation, I'm going to focus on looking at San Diego County overall and the differences by our HHSA regions. Next month, I will be going to our regional community leadership team meetings and be giving similar presentations focused on those individual regions. So if there's a specific sub-regional area and a specific region that you're really concerned about, you can attend that meeting and see my presentation. And then if you cannot attend, you can also go to that link I provided, and we'll be posting those presentations as they're given. So we're going to start with demographics and social determinants of health. So in 2024, San Diego County was home to 3.29 million people. Overall, the number of residents in San Diego County remained stable between 2019 and 2024. And then in 2024, North Central region was home to the largest proportion of residents, nearly 20% of the county's population residing in North Central region. North Inland region was the only HSA region which saw any increase in population from 2019 to 2024. Our demographic data that we use for our demographic profile on our website, as well as in our Community Health Statistics Unit presentations, comes from the Census's American Community Survey 5-year estimates. A lot of times folks will ask me, Chris, why do you use the 5-year estimates? We use those so we can get data below county level. Looking at age groups in 2024, 30% of San Diego County residents were 25 to 44 years of age. In San Diego County, 5.6% of the population was aged 4 or younger in 2024. And then in 2024, Central Region was home to the largest proportion of 25 to 44-year-olds, while North Central Region had the greatest proportion of residents aged 65 and old. Looking at race ethnicity, non-Hispanic white and Hispanic residents made up over 3/4 of the county's population in 2024. South region had the largest proportion of Hispanic residents, and then East region had the largest proportion of non-Hispanic white residents. Central region had the largest proportion of non-Hispanic Black residents. And then in North Central region, they had the largest proportion of non-Hispanic Asian and Pacific Islander and non-Hispanic residents of some other race resided in the large proportion of those residing in North Central region. Looking at educational attainment, in 2024, over 4 in every 10 San Diego County residents had a bachelor's degree or higher. In 2024, South region had the largest proportion of adults without a high school diploma. And then North Central region had the largest proportion of residents with a bachelor's degree or higher in 2024. From 2019 to 2024, every Health and Human Services Agency region had a reduction in the percentage of residents who were not high school graduates. Looking at unemployment, I will throw out this caveat, and for the unemployment data, this is a 5-year roll-up of unemployment data coming from the Census's American Community Survey data. So this wouldn't be as the more recent unemployment data you might hear on the radio, maybe driving to work or listening to a podcast. The 5-year average percent of unemployment from 2020 to 2024 was 5.8% in San Diego County. And then among our HSA regions, South region had the highest 5-year average percent of unemployment in 2024 at 7.4%. From 2020 to 2024, compared to the 5-year average percent of unemployment from 2015 to 2019, Central and South regions had a reduction in unemployment. East, North Central, and North Coastal regions had an increase in unemployment, and the North Inland region remained the same. Looking at poverty, in 2024, nearly 1/4 of residents lived below 200% of the federal poverty level. In Central region, nearly 1/3 of residents were living below 200% federal poverty level in 2024. And then from 2019 to 2024, all the regions experienced a decrease in the proportion of people living below 200% federal poverty level. A lot of times I'll get questions asking, Chris, why do we use 200% federal poverty level? We utilize that in San Diego County because of our high cost of living. The federal poverty level is set by the federal government for the entire country. And as we know, in San Diego County, we have a very high cost of living. Looking at food insecurity, among adults with income less than 200% federal poverty level, nearly half of residents were food insecure. In Central region, they had the highest proportion of food insecurity among adult residents with income less than 200% of the federal poverty level compared to the other regions in 2024. North Central and North Coastal regions had the lowest proportions of food insecurity in 2024, where about 1/3 of residents in each region reported an inability to afford enough food. Looking at health insurance, in San Diego County in 2024, 6.4% of residents did not have health insurance. Among the regions, North Central region had the highest proportion of residents with health insurance in 2024. And then although Central region had the greatest increase in coverage since 2019, it remained the region with the highest proportion of individuals that were uninsured in 2024. Looking at health status, a lot of these health status data that I'm about to provide now, they're coming from UCLA's California Health Interview Survey. In 2024, 1 in 10 San Diego County residents reported fair or poor health status. And then among the regions, North Central and North Coastal regions had the highest proportion of residents who reported excellent health status. In 2024, South region residents reported the highest proportion of fair or poor health status at nearly 16%. Looking at usual source of care, in 2024, about 1 in 8 San Diego County residents reported not having a usual place to go when sick or in need of health advice. Among the regions, Central Region had the largest proportion of residents who did not use a usual source of care in 2024. And then in 2024, North Inland and East regions were the regions with the highest proportion of residents who had a usual source of care. We're going to move into data regarding homelessness next. The point in time count conducted every year in January defines homelessness as lacking a fixed, regular, and adequate nighttime residence. There were 9,803 sheltered and unsheltered persons in San Diego County counted during the 2026 point in time count. And then during the 2026 point in time count, there were 5,108 unsheltered individuals, including 359 veterans and 1,676 seniors aged 55 and older. Among the regions, the largest number of unsheltered persons were in Central Region, where there were 2,249 people counted during the point in time count. Now, as I move into student homelessness, with homelessness data, depending on the data source, you'll see the definition change. This data comes to us from the California Department of Education. To be considered a homeless student in the California Department of Education, or the CalPEDS data, enrolled students must have reported experiencing homelessness at any point in time during the academic year. This includes students reporting residing in a hotel, motel, or a temporary shelter, living temporarily doubled up, or were temporarily unsheltered. In the 25-26 school year, there were 18,161 students experiencing homelessness in San Diego County. And then among the regions, nearly 1/3 of students experiencing homelessness were in the Central Region, followed by over 17% in the North Inland region. And you can see the map to the right on the screen here. The schools with one or more homeless student throughout the county overlaid on our sub-regional areas on the map. Moving into mortality measures. Life expectancy estimates. So my unit, the Community Health Statistics Unit, we produce the annual life expectancy estimates for San Diego County. Life expectancy is essentially saying a baby born in San Diego County, and in this case, for our latest data in 2024, that baby born in San Diego County is expected to have a life expectancy of 81.5 years. Among our Health and Human Services Agency regions, North Coastal region had the highest life expectancy at 84.5 years in 2024. And then by race ethnicity, Asian residents had the highest life expectancy in 2024 at 87.6 years, while non-Hispanic Black residents had the lowest at 75.2 years. I will again mention, as I mentioned in last year's presentations, San Diego has higher life expectancy than both the state of California and the United States. Looking at our leading causes of death, in 2024, there were 22,960 deaths among San Diego County residents. In 2024, cancer and heart disease were the cause of 42.5% of deaths among county residents. And then in San Diego County, 9 out of the top 15 leading causes of death were due to chronic disease in 2024. Now we're going to take a look at we're going to dive into some health outcomes. Looking at our chronic disease, leading causes of death, overall cancer and overall heart disease. The leading age-adjusted death rate in San Diego County was due to overall cancer, followed by overall heart disease. And then among the regions, East region had the highest age-adjusted death rates due to overall cancer and overall heart disease. For overall cancer, from 2020 to 2024, the age-adjusted death rate due to overall cancer increased for all regions except North Inland and South region. Among the regions, North Central and Central regions had the largest increases of their age-adjusted death rates due to overall cancer from 2020 to 2024. And then leading causes of hospitalization, overall heart disease and overall cancer in San Diego County in 2024. The leading age-adjusted hospitalization rate among chronic conditions was due to overall heart disease, and that is followed by overall cancer. Among age-adjusted hospitalization rates, East region had the highest rate due to overall heart disease, and South region had the highest rate due to overall cancer compared to the other regions. For overall heart disease hospitalization rates from 2020 to 2024, the age-adjusted hospitalization rates due to overall heart disease increased for all HHC regions. And then from 2020 to 2024, the age-adjusted hospitalization rates due to overall heart disease in Central, East, and North Central regions increased by 40%, just over 37%, and over 40% respectively. Looking at leading causes of emergency department discharge, that would be overall heart disease and asthma. Among the regions, East region had the highest age-adjusted emergency department discharge rate due to overall heart disease, and then Central region had the highest rate due to asthma at over 391 discharges per 100,000 residents. And then again, looking at asthma for emergency department discharge, each HHSA region had an increase of 64% or more in age-adjusted emergency department discharge rates due to asthma from 2020 to 2024. Among the regions, Central region had the highest rates of age-adjusted asthma ED discharge between 2020 and 2024, while North Coastal region typically had the lowest. The rates of age-adjusted emergency department discharge due to asthma in Central region were between 2.4 and 4 times higher than the rates in North Coastal region for every year from 2020 to 2024. Looking at Alzheimer's disease, in 2024, the age-adjusted death rate due to Alzheimer's disease in San Diego County was 32.4 per 100,000 residents. And then among the regions, North Coastal region had the highest age-adjusted death rate due to Alzheimer's disease in 2024. In 2024, the age-adjusted hospitalization rate due to Alzheimer's disease was 95.5 per 100,000 residents in San Diego County. And then among HHSA regions, South region had the highest age-adjusted hospitalization rate due to Alzheimer's disease in 2024. In 2024, the age-adjusted emergency department discharge rate due to Alzheimer's disease was 94.8 per 100,000 in San Diego County. Among the HHSA regions, East region had the highest ED discharge rate due to Alzheimer's disease in 2024. Looking at non-Alzheimer's disease dementia, in 2024, the age-adjusted death rate due to non-Alzheimer's disease dementia in San Diego County was 45.9 per 100,000. The age-adjusted hospitalization rate was close to 500 per 100,000, and the age-adjusted emergency department discharge rate was just over 505 per 100,000. Among the HSA regions, East region had the highest age-adjusted death rate, death, hospitalization, and ED discharge rates due to non-Alzheimer's disease dementia in 2024. Looking at some of our infectious diseases, communicable diseases, in 2024, the leading cause of infectious disease death in San Diego County was due to COVID-19. And then among HSA regions, East region had the highest age-adjusted death rate due to COVID-19, with a rate of 16.7 per 100,000 in 2024. And then again, with communicable diseases in San Diego County in 2024, the leading age-adjusted hospitalization rates among communicable conditions were due to urinary tract infection and pneumonia. And then among the regions, the East region and South region had the highest hospitalization rates for both urinary tract infection and pneumonia in 2024. Looking at pneumonia hospitalization rates from 2020 to 2024, the age-adjusted hospitalization rates due to pneumonia increased for all of the regions, and then the age-adjusted hospitalization rates of pneumonia were highest in the East region and South region between 2020 and 2024. And then continuing with ED discharge, in San Diego County, the leading age-adjusted emergency department discharge rate among infectious diseases was due to urinary tract infection, followed by COVID-19. And then among the regions, South region had the highest age-adjusted ED discharge rates due to urinary tract infection and COVID-19 in 2024. And then continuing with infectious diseases, the age-adjusted emergency department discharge rate due to urinary tract infection in San Diego County increased from 473 to 770 per 100,000 residents. South and East regions had an increase, respectively, in age-adjusted urinary tract infection ED discharge rates. Moving on to injury outcomes, the leading causes of death for injury include poisoning as well as traumatic brain injury. When I refer to poisoning in the presentation, please note that this would include drug overdoses would be included in this poisoning category. In San Diego County in 2024, the leading age-adjusted death rates from injuries were due to poisoning and traumatic brain injury, and then among the regions, Central region had the highest age-adjusted death rate due to poisoning, and the East region had the highest rate due to traumatic brain injury in 2024. Leading cause of hospitalization for injuries were falls and motor vehicles. In San Diego County in 2024, the leading age-adjusted hospitalization rate among injuries was due to falls, and then that's followed by motor vehicles. Among HSA regions, East region had the highest hospitalization rate due to falls, and the South region had the highest rate due to motor vehicle injury, again in 2024. And then looking at hospitalizations for falls, from 2020 to 2024, there was a 46.7% increase in the age-adjusted hospitalization rate due to falls in the Central region, compared to close to a 29% increase for the county overall for falls. Or that would be hospitalizations due to falls. And then again, with injury outcomes, in San Diego County, the leading age-adjusted emergency department discharge rate among injuries was due to falls, again, followed by motor vehicle. And then among the HSA regions, East region had the highest age-adjusted emergency department discharge rate for both falls and motor vehicle injury in 2024. Looking at motor vehicle injuries from 2020 to 2024, the age-adjusted emergency department discharge rate due to motor vehicle injuries in San Diego County increased from 393 to 624 per 100,000 residents. And then among the rates of age-adjusted ED discharge due to motor vehicle injuries in the East region were between 43% to 51% higher than the rates in San Diego County every year from 2020 to 2024. This is of note. This slide contains e-bike injuries. I will note you won't see e-bike in the key findings when I get to the summary for this presentation. That is not to say this is not a key finding. We added this slide sort of at the 11th hour before this presentation. So please take note of this e-bike slide as a key finding itself. For injury outcomes, among e-bike injuries in San Diego County in 2024, the rate of age-adjusted emergency department discharge was nearly 27 per 100,000 residents, and the rate of age-adjusted hospitalization was close to 6 per 100,000. Among HHSA regions, North Coastal region had the highest age-adjusted ED discharge and hospitalization rates for e-bike injury in 2024. There were 865 emergency department discharges due to e-bike injuries in San Diego County in 2024. 437 or 51% of those 865 were among those aged 10 to 19 years. And then moving into some behavioral health indicators, looking at suicide death rates from 2020 to 2024. From 2020 to 2024, the age-adjusted rate of death due to suicide decreased from 11.5 to 10.8 per 100,000 residents in San Diego County. And then in the regions, all regions except for North, Central, and East had a reduction in the age-adjusted suicide death rate from 2020 to 2024. In 2024, the age-adjusted death rate due to suicide was 36% higher in the East region than overall San Diego County rate. And then looking at any substance overdose, from 2020 to 2024, the age-adjusted death rate due to any substance overdose in San Diego County decreased slightly from 20.7 to 19.2 per 100,000 residents. The age-adjusted death rates due to any substance overdose in Central Region were between 54% and 87% higher than the rates in San Diego County every year from 2020 to 2024. And you can see Central Region in the orange there at the top of the graph to the right. And then among the HHSA regions, North Central, North Inland, and South had the lowest age-adjusted death rates due to any substance overdose from 2020 to 2024. Now, I know that was a lot, but I'm going to try my best here to summarize and give you some key findings. So some key takeaways in regards to demographics and social determinants of health. San Diego County, home to 3.29 million people. About 1 in 10 San Diego County adults ages 25 and over did not have a high school diploma in 2024, and then nearly 1 in 4 San Diego County residents were living below 200% of the federal poverty level in 2024. Almost half of adults with income less than 200% federal poverty level in San Diego County reported being food insecure in 2024, and then the 5-year average unemployment percent was 5.8% between 2020 and 2024 in San Diego County. In 2024, 93.6% of San Diego County population had health insurance. There were 5,108 unsheltered persons in the San Diego County during the 2026 point in time count back in January. And then some key takeaways for health. The life expectancy estimate, or a baby born in San Diego County in 2024 had a life expectancy of 81.5 years. And then in San Diego County in 2024, cancer was the leading cause of death. Overall heart disease was the leading cause of hospitalization, and falls were the leading cause of emergency department discharge. East, Central, and South regions had disproportionate rates of death, hospitalization, and emergency department discharge among the regions in 2024. These regions typically had the highest rates between 2020 and 2024. And then if you'll indulge me, real quick, I will show some Community Health Statistics Unit product highlights. These are just 2 products that we're really proud of, and I wanted to make sure the audience, if they didn't know about these, had a chance to know about them. Our Child and Teen Health and Wellbeing Dashboard, this was a collaboration between Public Health Services, Community Health Statistics Unit, and our Child and Family Wellbeing Department. We're really proud of this dashboard. The Child and Teen Health and Wellbeing Dashboard It focuses on demographics, social determinants of health indicators. It has data from the California Strong Start Index or the CASI, the Child Opportunity Index, education and immunization indicators, homelessness, mortality, and morbidity outcomes, all for ages 17 and younger. So if you have a chance, please check this out. On our website, it has a very comprehensive dashboard as well as an accompanying brief if you just want to kind of read the highlights. And then our aging dashboard. Also extremely proud of this. Again, a collaboration between Public Health Services and Aging and Independent Services. Um, the aging dashboard follows the California Master Plan for Aging, focusing on demographics, housing, health and mortality, inclusion and equity, caregiving, and affording aging. If you've seen the state of California's aging dashboard, this is very similar to that, just data specific to San Diego. So if it's aging data that you're looking for specific to San Diego, this would be where I would point you to. And I highly recommend you check it out if that's an area of interest. And again, I wanted to thank you for allowing me to present this data to you. If you're interested in seeing sort of our other data offerings, reports, data visualizations, or dashboards, please go to www.sdhealthstatistics.com. That will take you to communityhealthstatistics.gov page. Again, I am Chris O'Malley. Please reach out if you have any questions that you come up with after this meeting, and then you can also reach out to the unit via the email there on the bottom right. Thanks very much again.
Right. Thank you, Chris, for so much information and that wonderful presentation. I mean, who says lots of data can't be upbeat? That was fantastic. And thanks for diving into not just the San Diego County details, but putting in that e-bike metric, because that's something that I really wanted to take a look at. If the team can really quickly put up the slide with the upcoming leadership team meetings. Give me 1 second. Thank you. All right. As Chris mentioned, if you'd like to dive deeper into specific regions' data, we welcome you to join a community leadership team meeting in person and be part of the conversation, that important conversation. In the chat, I'm sorry, we'll put in the links as well. If you have, we have some times for questions, so please feel free to put questions in the Q&A box, and we'll have Chris answer some of those questions. Give me 1 second, Chris. Let me take a look at one of the first questions here. All right. Your first question, how can a program analyst determine which data should be collected and used to effectively evaluate programs that serve difficult to reach or high need populations, specifically data that may not show specific attainments, but small achievements for reaching greater program goals?
I know in my case, I'm always going to tell you like more is better. The more data that you can collect, the better. But I know obviously like you may be constrained, whether it be resources or it could be just a timeline. You may not have enough time. But it's really important always just to make sure that you're collecting the information on what it is that you're trying to achieve, whether that be through surveys, like at meetings, or whether that just be gathering data as you're interacting with the public. But again, it's going to be dependent on the actual project and dependent on sort of the level of resources that you have available.
Great, thanks. We've got another question here. Is there a repository for the data that informs strategic collaboration? Thinking of how having access to the same data in itself can foster more opportunities for collective impact.
At the county, we do have the county's open data portal where you can find the data for our live well indicators. A lot of the data that I show in this presentation gets posted to that. We also have data available at the Community Health Statistics website. And then a lot of organizations throughout the county are also going to have their own sort of data dashboards or data portals. Thinking of organizations like Sandag. They're also going to have that data available to you. I saw someone in the chat put the Healthy Places Index. That's also really good to make sure that you have utilizing any kind of indices, whether they be from the state or institutions like UCLA or the CDC.
Awesome. Thank you, Chris. I think those are the final questions. Let me just double check. Yes. Oh, here it is. Another question. Are the events that you're going to be speaking at that are upcoming here on at the CLT meetings only in person?
That's correct. These meetings in June will be in person. However, the presentations themselves, if you saw that link I put in the chat earlier, we will post those presentations on our website. So if folks are unable to attend, they'll have access to the data and the presentation itself.
Incredible. Thanks for clarifying that, Chris. And again, thank you to Dr. Tinkler, Io, and Chris. Before our announcements, we want to just quickly ask and let us know what you thought about the webinar and the information presented. We'll add the link in the chat, or you can scan the QR code if you like to complete the quick 2-question feedback form. There are no wrong answers. We'll give 1 or 2 minutes for everyone to fill this out. Thank you for putting that in the chat. And for this next slide, attention, all community-based organizations, do you offer work programs, job training, education, or volunteering opportunities? If you said yes, then we want to hear from you. The County of San Diego and 211 San Diego are teaming up to make it easier than ever for people to find the services you provide. Through the new Ready Work Hub, a one-stop shop connecting customers to resources that support CalFresh and Medi-Cal requirements. But we need your help to keep things accurate and up to date. So take a moment to update your organization's information with 211 San Diego. It's quick, it's easy, it ensures your programs get into the front of people who need them the most. Just click on the link that we're going to share in the chat. That's 211sandiego.org/partners, and make sure your services are ready to be discovered. Again, that's 211sandiego.org/partners. Help us connect the community to you. And thank you again for joining us today. For upcoming events, we have a career panel in early June. Hear about career paths in healthcare, academia, and trades, as well as workforce development programs. A couple weeks later, we'll have an in-person event about burnout and well-being. For more information and to register, please visit our Virtual Connection Hub website. The page will be updated with today's recording. If we missed your question today, please email us. As always, you can stay up to date with webinars and resources like this one today by subscribing to our newsletter as well. The link is in the chat. Thank you, everyone, for taking your time and joining with us. Thanks again to our fantastic presenters. And lastly, a big thanks to all of our staff behind the scenes for all the logistic work that they did to help make this production work together. That's all our time for together today. We hope to connect with you soon. Thank you.